diagnosis of anemia. What we do commonly, we do a complete blood count, and this test will help us estimate the amount of hemoglobin you have, and this will tell us to classify whether you have anemia that is mild, that is moderate, or that is severe. And also, we could also see on other parameters and tell that you could have had a chronic anemia or an acute anemia, but we could also tell that you have anemia that could be due to infections just by looking at your complete blood count. We have normal hemoglobin levels for both young and adults. For example, children tend to have hemoglobin levels between 10 to 14, and this is normal for them. For women, they have normal hemoglobin levels tend to be between 12 to 16, and for males, their hemoglobin levels is between 13 to 17. So depending on the age group, if you go below these normal ranges, then we say you have anemia. And of course, you may have mild anemia, you may have moderate anemia, and you may also have severe anemia. You may have acute anemia, and you may also have chronic anemia. So depending on your presentation and how long we have been with the condition, it's where we are able to classify this type of anemia. So how do we manage anemia? Depending on the symptoms and the time of presentation, some patients may benefit from blood transfusion. Patients who have mild forms or cases, we may just give them hematinics or iron tablets that they could take and swallow from home, or some syrups that contain iron, which could help them restore their hemoglobin levels. Another thing, we tend to manage the cause is very, very important, because if someone has severe malaria and their red blood cells are being hemorrhaged, and you do not treat malaria, these patients are going to actually progress to severe cases. So therefore, it is also important that we treat the causes. For example, hookworm infestation, we examine for them and then treat you. Another thing, we also have to manage diseases like cancer, which are affecting you, and cancers of the gut, of the intestine. We also have to treat the causes. So treating of the underlying cause is very important. We can also manage you. If you are having mild forms. We also encourage you to take feeds that contain vitamin B12 and also feeds that contain iron. So we encourage you to take fruits, to take green vegetables that are steamed in, that have the nutrients. We also encourage you to take things like liver, and all these are going to help you to restore your hemoglobin levels. So what is the take-home message? The take-home message is that you should be able to identify or to appreciate that there are changes on your body, and therefore you be able to seek medical attention when it is due. And also, when you have sought medical attention, would you please adhere to the advice that you are given? If you're given treatment, could you swallow those tablets, or you are going to hide them under the pillow? This happens a lot. And now, this is a message for the pregnant mothers. Pregnant mothers tend to get severe symptoms of anemia, and therefore are at a risk of getting actually heart failure that is due to anemia. Therefore, as a pregnant mother, when you take your HB, or they examine you and they tell you your HB levels are low, you need to take this matter so serious, because if you do not take it serious, then you tend to have a complicated pregnancy. You find that your blood pressures are so low, you are too weak, you have palpitations, because much as your body is demanding for iron, you also have a competitor, which is the developing fetus, and therefore you have two people who you have to have the iron stores for. Therefore, I encourage you, always adhere to the iron tablets they give you. And if you feel there are changes on your body, please rush, be examined, and be managed. To the women, if you are having bleeding that is more than 2 weeks and it is severe, I would encourage you not to sit home, but rather seek medical attention so that you are managed accordingly. If you get abortion and maybe you get continuous bleeding, it means that probably you did not get a complete abortion. You have an incomplete abortion. An incomplete abortion will make you bleed for a very long time, which predisposes you to anemia. So please, any mother out there that is watching this video, ensure that you take heed to the kind of advice I'm giving you. Don't take any bleeding for granted. Any bleeding on your body is a cause for alarm and therefore should be attended to accordingly, because once you do not, then you get life-threatening symptoms. Thank you everyone that has been able to watch this video up to the end. I am believing that you found this video helpful, and please remember to like the video, remember to subscribe, share with a friend, and please turn up again and again to find new updates. Thank you.